Our residents are proud of our NHS, an NHS free at the point of delivery, one that we rely on for our healthcare needs. And that reliance means that when we need it to work for us, we need it to work for us when we need it, particularly when we, any of us in this room, have a health emergency. We need to know that those services are going to be there when we need them. So against that backdrop, the latest news about our local NHS has made awful, depressing reading. An A&E crisis, with only something like 77% of emergency cases being seen within the 4-hour targets at our local A&Es in at least 1 week recently. Our local hospital trust requiring improvement in the opinion of CQC due to failings at St Mary's A&E, which we've heard about, and in its outpatient departments, amongst other things. And the continued threat to our hospitals posed by the continued Shaping a Healthier Future plans to close Charing Cross A&E. But let's talk about our A&Es. The current problem in A&E, you'll get a chance later. The current problems in A&Es at our local hospital are extremely worrying for everyone in our community. Maybe not shared, but we'll hear later. Imperial College NHS Trust admitted last week that they have been slower to respond to the crisis than they should have been. And the root causes of their problem, the current troubles, are not that obvious. Indeed, some of them seem to stem from an influx of elderly patients with complex needs, whose situation cannot be easily rectified. This problem will take sensitive handling between our hospitals and other agencies, and we trust that they will help to find the right long-term solution for these patients. It was, however, encouraging to hear last week at the Health Pack that Imperial have been able to take on 6 extra permanent A&E consultants. But this is a really puzzling development too, because for many years now, we've heard that the lack of such staff means that the A&E services at Charing Cross need to be closed down due to a lack of cover. Really? Really? This should give us all pause for thought as to whether those original claims were really true. And the attendances of A&E, rather than people attending their GPs, does strongly suggest that the out-of-hospital strategy, where hospital services are delivered in the community rather than in hospital, has yet to take hold locally. Much work is still needed to achieve a real out-of-hospital strategy that is trusted by our residents. I should say, and be very clear about that, that that is vital work, but it's not quick or easy to achieve, not quick or easy at all. But we should, as Councillor Luke and others have mentioned earlier, pay tribute tonight to the staff in our local hospitals who are working hard to care for our residents. These are tough times, and we salute their courage and care. They will always have our support and thanks for the tremendous job they do. The CQC report, though, made further disappointing reading. The report identified clear problems at St Mary's A&E and across the outpatients departments at each of the Imperial hospitals. It's also clear that leadership volatility at Imperial has not helped their cause. We'll be considering this in more detail at the Health Pack next week. But one message must be clear from us tonight. We demand the best quality care for our residents, and any failings, these failings must be rectified. But despite the problems with our NHS locally, we still have the threats of closure hanging over the A&E at Charing Cross and the removal of most of its acute services. But the evidence we've seen recently, high attendances and the crisis in A&E, the employment of further A&E consultants, the lack of bite of the out-of-hospital strategy, and the failings at Imperial shows that the rationale for these plans is weak and getting weaker. So, the Independent Health Commission's urgent review of healthcare in West London could not therefore be any more timely. And the fine local campaigners from the Save Our Hospital campaign continue to make the case on behalf of residents for keeping our local hospitals. So we now need to hear from the Healthcare Commission about the evidence I've talked about the Shaping Our Healthy Future campaigns, Shaping Healthy Future plans. Evidence that points to the need to save our hospitals for our residents.